you've seen in the medical tourism landscape. Please share your thoughts with us.
Hi everyone, my name is Gilliam Elliott. Like you said, I'm the founder of Medical Tourism Business. We specialize in working with medical tourism startups. We provide all the tools and resources they need to get up and going, whether that's certification, consultations with them, business plans, templates, everything they need to get started. So today my presentation is going to be in that vein. It's going to focus on basic parts of medical tourism and really just giving you guys a basic understanding of the industry and how it works. So just to get into the presentation, it's going to go over why UK patients travel for healthcare and how to facilitate their trips. So just to give you guys an overview of the presentation, I want to start off by going over what health tourism is, why UK patients travel for treatment, why Turkey is the top health tourism destination, how to set up a medical tourism facilitation business, and how to overcome business challenges as a medical tourism startup. So what is health tourism? Health tourism is when you travel outside of your immediate community for medical, dental, or wellness care. Now this can be domestically, traveling to another city or state within your home country, or internationally to a neighboring country or to a country around the world. Medical tourism is traveling outside of your immediate community for medical treatment, and it can be for major surgeries, minor surgeries, non-invasive procedures, and some of the most common procedures are weight loss surgery, cosmetic surgery, and orthopedic procedures. Dental tourism is one of the most popular forms of health tourism, and it's basically just traveling outside of your immediate community for dental care. And some of the common procedures for dental tourism are dental implants, veneers, and crowns. And a lot of people like to do dental tourism because it's perceived as being low risk. So a lot of patients, they feel like it's not high risk, like an invasive procedure or a major operation. So medical tourism is attractive to those individuals. And it also, a lot of people like to couple it with their vacations because there's virtually no downtime. You can get a quick procedure done while you're on your vacation and go back to having fun with your family and friends while you're abroad. And you can save a tremendous amount of money on dental tourism as well, which is why a lot of people opt to do it. So why has medical tourism grown in the UK? The reason why medical tourism has grown so much in the UK is because NHS long waiting times. Patients in the UK wait sometimes several months or sometimes even years to get treatments. And when it comes to dental care, a lot of dental clinics here in the UK are no longer accepting NHS patients. And so these patients who can't get treatment in the UK, they have to opt for private healthcare here in the UK, which can be very expensive. And when it's very expensive, they look beyond their borders. And so when they look beyond their borders and they travel abroad for dental or medical care, a lot of times they're documenting their trips. So they'll document when they get on the plane, they'll document their journey and the destination, they'll even document parts of their procedure. And when they do this, they share with their social media following, they share with their family and friends, and this is exploding the market. You can't go on places like Instagram and X and not see people documenting their medical tourism journeys. And this is really causing word of mouth, and I think it's really doing more positive than anything else in the industry. Why UK patients choose Turkey? So one of the main reasons why UK patients choose Turkey is because of the cost savings. UK patients can save anywhere from 50 to 70% in Turkey compared to private healthcare here in the UK. And many hospitals and clinics in Turkey hold international accreditations and certifications. So this instills trust, and it allows patients from the UK to have trust in these overseas healthcare providers in Turkey, and it allows them to go abroad and have confidence when getting procedures abroad. And also the short flight times. UK residents can get to Turkey in around 4 hours, and so it's relatively quick. They can hop on a plane, get a procedure done, and come right back to the UK. And Turkey is also, as you guys know, very rich in history and culture, so it's a tourism component to it as well. So how many UK patients travel for treatment? In 2002, it was estimated around 350,000 UK residents traveled abroad for treatment. And the most common procedures that these UK residents travel for are dental and cosmetic treatments. So what's next? We went over the UK market and why people in the UK are traveling abroad for dental and medical care, but I want to go over how to set up a medical tourism company to help these individuals seek treatment abroad. And the way to do that is by becoming a medical tourism facilitator. But what is a medical tourism facilitator? A medical tourism facilitator connects patients with hospitals and clinics abroad. They coordinate the medical trips for patients, they plan it for them, and they ensure a smooth and safe process for the patients. A medical tourism facilitator wears many hats, but being an educator is one of the primary jobs of a medical tourism facilitator. They help patients understand their treatment options. They help them understand the providers that will be providing the treatments to the patient. They let them know where the provider has practiced, let them know their success rate, where they went to school, just everything that the patient needs to know about their healthcare provider. And they also organize the trip for the medical tourism patient. They handle everything from medical records, so making sure that they send the patient's medical records to the healthcare provider abroad in a safe, secure way. They also set up appointments, hotels, and just organize the whole trip for them. They also manage communication between the patient and the overseas healthcare provider. So this is setting up everything from pre-consultations all the way to aftercare. And they also advocate for the patient. So the medical tourism facilitator, one of their primary jobs is to make sure that the patient's best interests are kept at hand. So making sure that the patient has a safe and secure trip as they travel abroad for this medical and dental procedure. Why patients use medical tourism facilitators? One of the primary reasons is because medical tourism facilitators are a one-stop shop, and they have access to top healthcare providers abroad. So these medical tourism facilitators are able to educate the patients on who the top healthcare providers are, what they specialize in, and like I said, all the credentials they need to know about the healthcare provider, because a lot of times patients, they have anxiety about going to another country. They might not speak the language. They might not know anything about the culture. So they're looking for someone to hold their hand through the process, and that's what these medical tourism facilitators provide. They also, like I said, schedule appointments, book flights, help the patient with their visa, and also help them with aftercare and before care as well. And if something does go unplanned, they help them in emergency situations or just guide them through the trip. And overall, their job is to make the patient have a better outcome and a smoother, safer, more organized experience. Who are medical tourism facilitators? So as I said earlier, we specialize in working with medical tourism startups. So we see people from all walks of life. Medical tourism facilitators, sometimes they're also ex-medical tourists. So a lot of times people will come to us and I'll ask them, how did what made you want to start a medical tourism company? And they'll say, hey, well, I went abroad for a dental procedure, or I went abroad for a medical procedure, and I had such a great experience. I want to help other people get the same experience. But there was a lot of things that I didn't know, and I think I can educate people on this experience. And so they're excited about it because they've done it, they've seen the results, and they become medical tourism facilitator as a result of that. And sometimes we get people who are from the medical or travel fields who want to become medical tourism facilitators because they have backgrounds in these different parts, and they feel like their background could help them achieve a successful business in the medical tourism industry. And sometimes we just have entrepreneurs from no related industries. They might say, hey, I've been doing research and I ran across medical tourism, and I've seen how it's been growing by 25% each year, and I want to know how I can get into this industry and start a successful business. And we help them start those businesses. And when it comes to medical tourism facilitator businesses, they come in all shapes and sizes. So I've seen everything from large multinational companies to mid-sized businesses to small mom and pop businesses, all the way to home-based medical tourism facilitators, and also digital nomads. So we have a lot of people who are attracted to becoming medical tourism facilitators because you don't necessarily have to do it out of your home. You can also travel and do it as long as you have internet connection, reliable healthcare partners abroad, and able to communicate and run your business as you travel. So common challenges that I see startup medical tourism facilitators face are, one, finding reliable partners. Another one is understanding the market. And when I say understanding the market, I mean understanding the industry best practices, trends that are going on, common pitfalls, and how to avoid missteps. Another big challenge that we see medical tourism facilitators run into is building credibility. Whenever you're starting a new company, people might not know who you are, and these medical tourism facilitators run into that. They talk to customers or potential customers, and they have no background because they just started their business, and customers are thinking in their head or asking them, how do I know I can trust you? What's your background? And so that's a challenge that we see people run into when they're starting medical tourism companies, and also marketing and how to get in front of their target audience. And that goes into managing their expenses as well. And then the last one on this list is risk management. When people are starting medical tourism companies, a lot of times they're worried about how do I protect my business, myself, and my clients during the medical tourism process if something goes unplanned. So I want to talk about how to overcome these common challenges. So with finding reliable partners, they're going to have healthcare partners abroad. So one of the best things medical tourism facilitators can do is do site visits, where they go on site to these medical facilities abroad and they survey the site themselves. They meet their potential healthcare partners, talk to past patients who've had a procedure done at this practice, and really just get a feel for the overall clinic or the hospital, and make sure that it's up to date and it meets their standards and they're comfortable promoting it to potential clients. Another thing we talked about earlier is credibility. And when you're starting to build it, and when you're starting a company, as we said, you run into a credibility factor because you don't have a background in the industry. And one of the best ways to overcome that is by getting certified. And certification just shows that a third party has verified your company is legit, and just shows that you hold yourself to a certain standard. And the third one on here is defining your target market. So when you first start your company, you might not know exactly how to market your company, and one of the best things you can do when you're starting your company is focus on your ideal client. That's the way you're gonna be able to keep your expenses down. And when I say focus on your ideal client, I mean come up with an avatar of who your ideal customer is, where they're located, their age, their income. Do they have kids? Are they single? Are they married? Really getting an idea of who your ideal customer is, and then developing content and marketing directly to that ideal customer. And another thing that we see people run into is their expenses, right? When you're starting a medical tourism company, you might have a limited budget. And a lot of times people do have a limited budget because they're just starting out. And you have to track your expenses and find out ways to cut your costs. And one way to do that is understanding what you can do in-house and what you have to outsource. And what I mean by that is, if you have a background in, let's say, marketing or web development, you might be able to do that yourself. But if you have no background in marketing or web development, you may want to outsource that to a professional and spend money on that. So you have to weigh what you can do yourself and what you need to outsource and what you need to hire professionals for. And then the last one on this list is protecting your business, yourself, and your clients. So the best way to do that is by having strong contracts. One contract you want to have as a medical tourism facilitator is a patient waiver agreement. And that patient waiver agreement is between yourself, which is a medical tourism facilitator, and your clients. And it outlines to those clients who are medical tourists, it outlines to them what the benefits and the risk of getting medical tourism or getting medical procedures abroad are, and it outlines to them what you'll be providing to them as a medical tourism facilitator. So it makes everything crystal clear. It lets them know that you're a medical tourism facilitator, you're on a healthcare provider, and all the information that you'll be providing to them will be educational in nature. And you also want to have a contract between the facilitator and the overseas healthcare provider. This also lays out what you'll be providing to the overseas healthcare provider and what you expect from them in this partnership. And my final thoughts is that facilitating trips to Turkey is a big opportunity for medical tourism facilitators. And starting a medical tourism agency, one of the surefire ways to have a successful company is by having strong partnerships, strong contracts in place, and making sure you understand industry best practices. And it's my observation that UK patients will continue to seek treatment in Turkey as long as they keep providing affordable and high quality care. Thank you.
Thank you very much. Thank you very much, Gilliam, for your presentation.